Hi friends, so in this video we shall be discussing a very small topic, which is your thromboelastogram. We shall be mainly focusing on the tracing of a thromboelastogram. So but before we proceed, what is a thromboelastogram? It is a viscoelastic assay. So what they do, they basically monitor hemostasis as your dynamic process. Right. Now another type of viscoelastic assay is your ROTEM. What is ROTEM? ROTEM stands for your rotational thromboelastometry. So they measure your viscoelastic properties of the blood as clotting is induced in your low shear environment. So the pattern of changes in the shear elasticity enable the determination of kinetics of clot formation as well as the strength and growth and stability of the formed clot. So this is your monitoring of hemostasis as a dynamic process. Now the basic difference between your ROTEM and TEG, we won't be going into the basic differences a lot, but the main difference is that they both actually employ a vertical pin which is lower in activated blood. Now what happens in a TEG is that the cuvette is oscillatory and the pin is stationary, whereas in case of ROTEM what happens is opposite of this. So where your cuvette is your stationary and pin oscillates. So this is your one of the basic differences between TEG and ROTEM, which I would like you all to remember. Now the tracing of a TEG is something like this. So now we need to know what is R, what is K, what is this alpha angle, MA and LY. So let's begin our discussion with R. Now R value is your time between the start of assay and the initial clot formation. So let me write it down for you. Start of assay and initial clot formation. So what does it reflect? It reflects your clotting factor activity and your initial fibrin formation. Right. So if you see over here, it is showing a prolonged R. Now what are your conditions that actually leads to your prolonged R? So this is increased with your factor deficiency and hemodilution. So what would be the treatment? The treatment would be your plasma transfusion. So why are we actually studying this? Because this all finds your clinical implications in case of a trauma patient, where your TEG would help us to decide early what would be the source of the blood product that needs to be transfused to the patient. So if in TEG you find a prolonged R, it would basically imply a factor deficiency or a hemodilution, and you would need to go for a plasma transfusion. Now next is your K time, which is your clot kinetics. Now this is the time to reach the clot strength. So if we look at the diagram over here, now this K is your time to reach the clot strength. Now this is your interaction between the clotting factors and platelets. So when is it prolonged? It would be prolonged if you have your factor deficiency and in case of your hypofibrinogenemia. Right. Now what would be the treatment? The treatment would be same, which is plasma transfusion. Right. Now moving down to the next, which is your alpha angle. Now this is your alpha angle, which is actually your slope of the tracing and it reflects your clot acceleration. Now again, this is your interaction of your clotting factors and platelets. Now it is decreased again in case of hypofibrinogenemia and your platelet dysfunction. So the treatment over here in case of your decreased alpha angle includes your cryoprecipitate and your fibrinogen. Right. So these are your few important points with respect to your alpha angle. Now the next important tracing in your TEG is for your MA. Now if you can see over here, MA is your maximum height, right? So this is your maximal amplitude. Now this is your greatest height, which represents your clot strength. Now this is decreased due to your defect or deficiency of platelets, right? So the MA is decreased due to the defect or the deficiency of your platelets. So if you see over here, this decreased MA is because of your platelet dysfunction. So your treatment would be your platelets transfusion. But where the slope also decreases, over there you would need to give cryoprecipitate and fibrinogen. Right. Now if it is an increased MA, that represents your hypercoagulable state. Right. Now moving down to the last tracing of your TEG, which is your LY. So what is this, your LY? So this is the amount of lysis occurring in the clot, and the value is the percentage of amplitude reduction at 30 minutes after MA is achieved. So the increased LY30 is suggestive of your fibrinolysis, and this is the point where your treatment would be requiring tranexamic acid. Right. So if you see this study of your hemostasis in dynamic fashion is the viscoelastic property study by your thromboelastogram. So the important things that we need to remember in your thromboelastogram is your R value, which is your time between the start of assay and the initial clot formation. Now what happens if it is increased, right? That means there is factor deficiency in hemodilution and you would require a plasma transfusion. Whereas if the K time which represents the time to reach the clot strength. Now this is the interaction of the clotting factor and the platelets. So if it is prolonged, it is suggesting the factor deficiency in hypofibrinogenemia. So now the treatment would include your plasma transfusion. Now the alpha angle is your slope of tracing and it reflects your clot acceleration. So there is interaction of your clotting factors and platelets, and this is decreased in hypofibrinogenemia and platelet dysfunction, and the treatment would be requiring your cryoprecipitate and fibrinogen. Now MA is your maximal amplitude. This is the greatest height which determines or represents the clot strength. Now decreased MA is due to the defect or the deficiency of platelet. So you would be requiring in your treatment your platelet transfusion. But in the cases where your slope also decreases, in such cases you would need to administer cryoprecipitate and fibrinogen. Now the increased MA represents your hypocoagulable state, and your LY30 is the amount of lysis occurring in the clot, and value is percentage of reduction at 30 minutes after MA is achieved. Now increased LY30 represents fibrinolysis, where your treatment would be including your tranexamic acid. Now from this particular topic, you might get a question directly from this particular image of the tracing of TEG, right, where they might ask you direct one-liners as what is R value, what is K, what is angle, alpha angle, what is MA, and what is LY, or they might just give you clinical based scenario saying that there's increased LY30, so what would be your treatment option, or it could be on the basis of the various diagrams like this: prolonged R, what would be your treatment; decreased MA, what is the diagnosis and what would be your treatment; and increased LY30, so what would be your diagnosis and what would be your treatment. So this is all about from the topic thromboelastogram. Thank you.